Good morning, everyone. Thank you guys for coming and meeting us in North Bethesda. We are so glad that we could get together. We tried for downtown, but government per diem only goes so far. So thank you again for joining us this morning. I just want to thank all of you again for coming, and thank your coaches and your assistant coaches and your federal team and the rest of the STAR team, because this has been an intense 10, 11 months, and we just appreciate everybody working together to get us to this point. We're calling this the Capstone meeting, but when I was thinking about it, it's really not. It's more like your sixth grade promotion to middle school. You've done something, but you have a lot more to go. So thank you and congratulations for making it to this point. We started last September in 2023 with 8 teams. We lost one in transition. So I just want to thank Arizona, Michigan, Kentucky, California, West Virginia, Iowa, Oregon, Chippewa Cree, and Pasquayaki for continuing and holding out. This has been a year-long initiative, working with your coaches, working with your teams here, and back at home, and strengthening your partnerships with your TANF and child welfare colleagues. This is, like I said, a promotion exercise, and we're here to celebrate the accomplishments and lessons learned that have happened over the last 10 to 11 months, and help you think about what's going to happen next. What are your sustainability plans? So this is a day-and-a-half meeting, and it will provide you with a lot of opportunity to listen, to share, and acquire insights and knowledge from one another. So the goals of today's meeting, I guess that's next slide, Mark, is to learn from one another about the approaches and strategies you've designed and implemented, explore and apply the strategies to promote the advancement and sustainability of TANF and child welfare partnerships, and inform us, OFA and Children's Bureau, strategies and thinking about how to support your innovations and partnerships, and to spread this energy throughout the field. So for today, we're going to be, it's an action-packed day. We're going to have a speaker to talk about maintaining focus and energy. She is Brenda Donald, and I'll give you introduction in a little bit. Then we'll take a break. We're expecting a lot of thought and energy, mental energy. So we're going to give you several breaks throughout the day. We're going to have discussion circles so y'all can share amongst each other. So a lot of sharing time here. A debrief of the discussion circles, lunch on your own. As you can see, there's not a lot around here. So we're recommending that you eat at the restaurant because we only have an hour and a half. It's not like DC, who's famous for speeding tickets and parking tickets. So at least you're immune from that, but it's not a lot around here. So just want you, it'll be good to stay in the area. Lunch on your own. Then we'll have some team time to prepare for the gallery walk. We've seen this a couple of times, but the success of it is your flexibility. We have plans, but when we make plans, God laughs. So it's an opportunity for you to share. The times we have set times, but they might be a little bit more fluid in case, depending on the level of discussion and conversation. After we have 2 rounds of the gallery walks, we'll debrief, and then we'll close and get ready for tomorrow. So I would like to introduce our keynote speaker, unless anybody has any questions before we move on. Okay, I want to introduce Brenda Donald. Brenda Donald has over 30 years of senior management experience in the public and nonprofit sectors. She has served 3 District of Columbia mayors, twice as deputy mayor for Health and Human Services, 3 times as the director of Child and Family Services Agency, and most recently as an executive director of the DC Housing Authority. She also served as a Maryland Governor Martin O'Malley's cabinet secretary for Human Services. As a director of the DC Child and Family Services, she is widely credited with accelerating the district's ongoing child welfare reforms and establishing a host of performance improvements. Use of best practices in addressing reports of child abuse and neglect and increased support for families helped to reduce the number of district children in foster care from 1,800 at the start of fiscal year 12 to fewer than 600 at the end of her tenure. Brenda will be speaking on the topic of maintaining focus and energy for change. Please extend a warm welcome to Brenda Donald.
Good morning. I'm so glad she didn't read the whole bio, and I apologize if you had to read it because I normally send the whole thing and say, just cut it down. But 30 years experience, you got a lot of things to talk about. But I am really delighted to be here with you this morning. When John asked me to speak, I'm like, well, these are my people. And it's so refreshing to know that there are people all over the country who've come together to really focus on creating systems, integrated systems to serve our families better. So I'm just going to talk with you for a few minutes. I hope you're going to want to have some conversation afterwards. So again, thank you for allowing me to be part of your capstone event. So I'll admit, when I was invited to speak with you today, I had not heard of Fast LC. Frankly, I was bewildered when I saw the subject line in my email. I'm like, is this some kind of spam thing? Are they soliciting for something? But of course, when I read what it meant, families are stronger together, learning community, it made sense. And yes, families are stronger together, but so are the organizations who support them. And whether they are governments, tribes, community nonprofits, faith communities, and other partners who make up the family support ecosystem. I used to always say when I was running the Child Welfare Agency, we are the Child Welfare Agency. We're not the child welfare system. That is much broader than any one agency, and that's the focus of your learning community over this last year. The old African proverb, it takes a village to raise a child, has become somewhat of a cliche, but in my opinion, it's never been more relevant than in today's often isolated and disconnected world. But before I talk about why you can and must sustain the transformative work you have put in as part of this learning community, I wanted to take a minute to congratulate the teams for your commitment and focus during this past year. So give yourselves a round of applause. It's a lot of work. So some of you came together in this learning community as new partners, right? Forming allegiances with colleagues that you may not have known or ever worked with before. Some may have started and then there were changes over the year. That's kind of the life cycle of the work that we have. People come and people go. But the challenges and needs of families stay, and that's what's important. Others solidified collaborative partnerships that already had strong histories, and other teams were formed just for this grant. Hey, it happens, but that's okay. I mean, in fact, ACY, Department of Human Services, and other funders often create opportunities like Fast LC to catalyze the on-the-ground collaborations so to improve outcomes for the families we serve. And I know that's why you embarked on this journey. And it's clear from your projects that you understand the importance of working across systems to support families when they need help, to invest in upstream prevention services that can provide lifelines to families, and to lay the groundwork for integrated systems that actually help. The families we serve are complicated, no question about that. It's more surprising than not that a family will come to the attention of a single agency and not need or benefit from services from another. Mom may be on TANF, dad is participating in workforce development, one child is in foster care, the other is receiving mental health services, And perhaps grandma is getting services from the Office on Aging, right? Sounds like our families. That's just the way, the reality of the lives that they live. In the two primary worlds that came together for this learning collaborative, TANF and child welfare, there's really a whole body of research and data collection on the juxtaposition of child welfare and TANF. The two are of course linked by the, and I'm going to say, hated TANF look back eligibility requirement for 4E funding, but that's really a topic for another day. And there are folks who are working on that as well. And I'm part of that. So, but the main point is that there's a high correlation between families who receive TANF and child welfare involvement with the child welfare system. But of course, you already know that, as evidenced by your thoughtful and innovative approaches put forth for this initiative. Now, I know you're going to showcase your projects and you've got gallery walks and you're going to be talking among your teams over the next day and a half, but I wanted to take just a few minutes to highlight your proposals to kind of lay the foundation for how and why this work must continue. Now, where's Arizona? I love Arizona's strategy to enhance local family resource centers by transitioning them into community action agencies. This transition will enable the family resource centers to tap into TANF funds, empowering them to bolster their services and better support families in need. Family resource centers all over this country have proven to be important community resources that meet families where they are and provide services in a supportive and non-threatening way. But a number of states and cities have invested in the family resource center model, but most are funded by local dollars, foundations, or other private funds. And I'm really proud of the 10 family success centers we established in Washington, D.C. when I was the child welfare director, but they are totally funded by local dollars. So I think your plan is a brilliant one to tap into additional federal dollars to augment and bolster the family resource centers. As I always say, and apologies to our federal leaders here, but I'd rather spend my uncle's money than my daddy's. So let's leverage those federal resources in many ways. Now, in California, where's the California team? Oh, there you are in front. California, and California's got a long history and many examples of innovations and cross-systems collaborations for families who rely on multiple public agencies. Well, your goal to expand the linkages program between CalWORKs and the child welfare system, take it statewide, I think is really important about sustainability. I know you're also exploring potential pilot of linkages with up to a number of your tribes. And it's really noteworthy that the state will work on to disaggregate the TANF data to identify disparities in uptake of services with disparities in child welfare and figure out what is going on. Because a lot of places have lots of services and resources that families just either don't know how to access, can't access, don't think are relevant to them, or just decide not to participate. And so really understanding that, I mean, trust me, we've had in DC successful 4E waiver program. We were the first in the country with our Family First plan. Looks fabulous on paper. The reality on the ground are things that you really have to focus on and push. And doing the real data analysis to determine what is going on and to make adjustments along the way is really, really important. Now for the Chippewa Cree tribe, where are you? Okay, back there. Oh, I'll say one hand. Okay, I'm sure you got other partners, but I love that you brought child welfare, the TANF, child welfare, and schools to collaborate on the design and implementation of your wraparound care program to holistically support families in a culturally relevant and sensitive way. The schools are such important partners since they see the children regularly for the largest blocks of time. And in many jurisdictions, schools have, almost everywhere, are independent entities that may or may not be part of they may be a county entity, they may be an independent entity, but not necessarily a logical partners, and sometimes not always willing partners, but really, really important because they know these children and families and are well positioned to identify when families are struggling and need help. Oh, I was at a convening many, many years ago when someone cited a report that said that the state's prison system projected the number of prison beds it needed 15 years in advance based on the number of Black and brown boys who were suspended from school by third grade. I was like, wow, if they use that data to make multi-million-dollar investments in prison beds, shouldn't we use that data to prevent that from happening? It can project out, but so can we. And that's the beauty of going upstream, is really identifying the points at which a family is either struggling, needs a lifeline, but has an opportunity to go in a different direction. So focus on what's challenging our families to support their kids. I believe fundamentally, all families want their kids to be safe and successful and do well. Families want to as well. But let's help them address those challenges. In other words, change the odds, create positive pathways instead of inevitable failures. Now, Iowa, where's Iowa? Iowa here. Hey, guys. And Kentucky? Back there? Great. So I love the way that you are using this learning collaborative to assess the current landscape of service delivery and family engagement, right? So you can identify the appropriate collaborative opportunities. One size doesn't fit all. We're saying, like, if you've seen one child welfare agency, you've seen one child welfare agency. They're all different and systems are different everywhere. So you've got to really look at the landscape in your own jurisdictions. So during the first several months of this year, I know the Iowa team surveyed families, conducted listening sessions with frontline staff to better understand their experiences and what ideas they have for improving service delivery. Similarly, Kentucky is working across its TANF and child welfare departments to develop surveys and other feedback loops with staff to better understand their perceptions of the other department. It's really important as well, right? We can be in our silos and it's like, well, I do TANF benefits. Well, I'm protecting children. I'm doing this, that, right? And we all have our missions. We all have our mandates, right? But let's just step back to what end, for what purpose. And so really understanding, and that happens at the staff level. So if you're in the early stages of cross-system collaboration, it is critical to do the lay of the land assessment and to use data to inform your strategies. But kudos to Iowa and Kentucky for engaging frontline staff. Not only do they understand what is happening on the ground, they're also key to any meaningful and lasting systems change. When I came in as cabinet secretary in Maryland, someone told me, it's like, we've seen secretaries come and we've seen secretaries go, but we're going to be here. We'll be here when you get here and we'll be here when you leave. I call them the B team. They are really important. Those are the folks and they are closest to the front line. And so to do top-down strategy never works. Leadership is important. Giving those messages and making sure that people understand really the why and where you're going, absolutely critical. But you've got to invest as staff. So, and it was very, very smart. Now, where's Michigan team? There. I'm actually going to be doing some work with Michigan child welfare leaders. So I love this. Michigan is a great example of taking it to the next level by moving from piloting its family impact teams to scaling it across the state. The FIT project proactively connects families to services outside of the child welfare system to strengthen families, reduce system involvement, and provide easy access to safety net resources through a TANF child welfare collaboration. I'm really glad to see this. All too often, pilot programs never move beyond their initial pilot stage. And when I first went to Maryland to run the Human Services Agency, I discovered a few really promising pilot programs that we're either stuck or abandoned. And my team got tired of me saying, I'm not running an airlines. I don't want to do pilots. If it works, we need to incorporate it system-wide. So pilot is good. The purpose is testing, but you really should be thoughtful and intentional about if it's going to work, what does that look like? How do we evaluate that? How do we assess impact? And then let's scale it. If it's not, then time to move on. But we can get stuck. So I think it's great that Michigan is moving in the right direction by building the organizational infrastructure to take FIT statewide. That's another thing, is that just because it's a nice initiative here, and that you got to build that organizational infrastructure to really do real systems change. But of course, you have to determine, before you can take a program from pilot to mainstream, you have to determine its efficacy. Does it work? Does it make sense? Does it just work over here in this particular county or this jurisdiction because of the characteristics, the population, the partners? Is it something that we really need to take statewide? How do we modify it and make sure that it works? And so that's where's Oregon? Back there, thank you, or up there. So what I understand Oregon's Department of Human Services is doing with its framework for equitable, consistent tracking and assessment of improvements to program policy and practice. You got to do it. It's not the sexy stuff. It's not the stuff that people will understand. Trust me, I was talking with someone yesterday about my tortured tenure and my post-child welfare retirement work running the Department of Public Housing. Huge challenge, and we can have a debate about which is harder, child welfare or public housing. I'm going to vote for public housing, but but the point was, that there's like pent-up demand and a lot of frustration with not doing things quickly, right? And that people understand, depending on where your organization is, you may have to completely rebuild the organizational infrastructure. You can't get out in front of yourself with launching initiatives where you're not ready to see if they work and to make those adjustments, right? At the same time, you don't want to just take years and years and years and years to study and get things right. So there's always kind of a balancing act. But also I wanted to point out too that Oregon is also engaging staff in identifying what has impact and what does not. So that's really important as well. Data will tell you certain things, but the staff will also tell you who's showing up, who's not showing up, why. We did in DC a big push to do universal home visiting, and we had the resources to do it. We found that some of our families, and we were using the evidence-based, I think the nurse family partnership or nurse home visiting model, where you're literally going into people's homes and assessing the health and well-being of the baby and how the parents interact and all of that. Well, we found that some of our families didn't participate because they felt it was an intrusion to have strangers coming in their home. And you think about families who've been stressed year after year with all of the requirements we have, where all of our agencies are compliance-driven agencies, and it is important to have accountability and make sure that we are doing what we're supposed to do and we're reporting on it. But families who have been involved in multiple systems, who are having visits from caseworkers, who have to go different places, and then they're saying, oh, this is a wonderful program to help you engage better with your baby, and we're going to be coming in here once a week, and they're like, so we had to modify it. Now, did that meet the evidence-based challenge? It did not. We modified it to do smaller, more community-based home visiting with small groups of cohorts. But that's what the families told us they wanted. And guess what? We had a much higher take-up of that. And so that's, again, really looking at and listening to, of course, the families you serve and listening to your staff so that you really are developing and implementing the kinds of programs and services that work, that families will access. Now I'm hoping I'm going to pronounce the tribe's name, Pascuayaki. Did I say that right? Where are you? Is that okay? Close enough? Tell me. Pasquayaki? Better. Thank you. So your TANF and child welfare programs are focusing on streamlining services across your agencies. Now, each agency has it, and that's demanding in and of itself. But I can tell from reading your project summaries that you signed on for this initiative because you believed it would improve your abilities to serve the children and families you care about. After all, none of us does this work for the money, right? I don't know. Some of y'all may be better paid in some of your jurisdictions, but we don't sign on for this for the money. I mean, for me, it's always been about social justice and equity. Each of you has your own reasons for doing this important work, but I believe we are all driven by passion, compassion, and a desire to improve the lives of the families we serve and to make the systems work for those who need them the most. Throughout my career, I've had the opportunity to lead complex systems designed to help people. In addition to leading the Child Welfare Agency, as you heard, I've twice served as deputy mayor for Health and Human Services, and that encompassed a wide range of agencies: child welfare, public benefits, homeless services, mental health, substance abuse, health, developmental disabilities, and services for seniors. And my official title was deputy mayor for Health and Human Services, but I like to refer to myself as deputy mayor for all God's children. It's cradle to grave services. And in fact, I told someone one time, I said, well, I think I'm covering, all aspects of families and individuals. And I said, but I don't have pets. And they were like, well, yes, you do, because animal control is with the Department of Health. So I was like, okay, I got it all covered. But that was really important to be able to have all of those agencies. And similarly, when I was in Maryland's cabinet secretary, I had TANF, the public benefits, child welfare, and child support enforcement, which I thought was basically a big, collection agency. And that's how it had been run for years. But when I stepped back and saw that many of the non-custodial parents, most of them were dads, had children who were in the child welfare system or moms who were receiving TANF, then we started working on developing strategies to support the dad's ability to take care of their children through workforce programs that also we had for our children who were aging out of foster care and our parents who were in a TANF program. So really kind of thinking about, why does someone come to the attention of these systems that we run? Nobody wakes up wanting to do that. And so there are things that lead them there. How do we figure out how to help them go for to take a different pathway? And so the point I want to make is these agencies represent not only the safety net, but also the opportunity platform for families struggling with various challenges. And using data and geomapping in DC, we confirm what we already knew, that these agencies were serving same kids, same families, same neighborhoods. Like, a lot of people were like, why did you go from child welfare and now you're running public housing? And I'm like, we set up 10 family success centers, 6 of them were in public housing projects. And they were driven there. We designed them there based on data and geomapping. That's where the families were. That's where the families who had multiple needs and multiple issues, and that's where they lived, so we can bring the services to them. But we had to figure out ways to reduce barriers for families. How do we create no wrong door approaches? How do we share data? Collaborate on case management and otherwise share resources. In other words, we had to get adults to play together and share their toys, which was another one of my themes of my whole career. So I'm not going to pretend that any of this is easy or quick. Now, some of you are in the early stages of building collaborative partnerships across systems, while others are moving beyond pilots to statewide implementation. And I imagine many of you have tried various approaches over the years, only to see efforts stopped when someone leaves, or a new mayor or a new governor is elected, or grant ends, or other reasons. But stops and starts are frustrating. But I invite you to think about systems transformation as a long game, a marathon, not a sprint. One of my good friends is the executive director of the Sault Ste. Marie tribe of Chippewa Indians, and where she previously served as director of community and family services. Christine leads her nations with the tribe's powerful philosophy. We plan for 7 generations. Think about that for a minute. I'm like, can we plan for like an election cycle or on a term of an appointment? Plan for 7 generations. Similarly, one of my colleagues used to say, we are planting shade trees we will never sit under. It's not about us. It's about what we can do now. But as leaders, we have to think about planting seeds that may not bear fruit during our tenure or even our political leaders' terms, but which is always a pressure point because I always want to show something, and we can. It's not that you do nothing, but we have to deliver tangible, important benefits and change. But it's to demonstrate that systems change is real, but also more importantly, to improve the lives of the families we serve. So yes, applaud yourselves for all that you have accomplished in the past year, but think of it as a deposit on a long-term investment in systems transformation. Plant the seeds deeply so that they're not just showy annual flowers, but perennials that keep blooming year after year. Be a champion who advocates for things differently, for moving upstream, for meeting families where they are, for braiding and blending resources, for creating no wrong door policies and practices. Use your FAST LC initiatives to show your colleagues in other agencies how it can be done, because you need to strengthen your networks beyond just child welfare and TANF. And I know you know this, but you need your Medicaid, your mental health, your substance abuse, and other human service partners to join you on this pathway to serving families differently. So plan for 7 generations. Plant those shade trees you will never sit under. And please continue to play together and share your toys. So thank you for allowing me to be here with you today. I saved some time for some discussion, so I hope you have some questions to kick things off. Thank you. It's not that early. Okay, you all are all ready to go back and take the charge forward. I'll say a couple of things though and I know that tomorrow you'll hear from Linda Spears, and she's going to talk more about how you do this and how you sustain these efforts. There are some really practical things that you can do and you have to think about. And I've mentioned a few of them. Some of you have teased out in your project plans. Building that organizational infrastructure, huge, so that this is not someone's initiative. And I made that mistake early in my career where I was like a hotshot assistant city manager, a whole nother world. And we were really building a different way of engaging families and communities in the city government, and created we call them alert centers, which now look and sound like family resource centers. But I thought, oh, this is awesome. We created all of this, and we've changed the way we're operating. And it was just, and then I left and went on to do other things, and it fell apart. And so people are like, oh my God, you left, and you were the one, you were the champion, and then there was no one to take it up. And at first I was kind of like, yeah, I was so bad that I did all this stuff. And like, that was horrible. That's not leadership when you're leaving something, or it's an initiative that is your name or associated with you. And we all have our political leaders that we ultimately report to and have to show up for. But I think it's really helping to make this make sense to people who are not part of our worlds, right? And so in DC, I really pushed, and this is before I was even deputy mayor, maybe that's why I became deputy mayor, but really pushed this, that if you are not investing in and supporting, and this was one specific area, kids who are aging out of foster care, that when we had a much larger number of kids in foster care, that was a huge bubble for us. So the kids aging out, and like several hundred of them every year. And I'm like, if we are not building real transition plans for these kids, connecting them to our other systems, making sure they're eligible for any kind of resources, providing housing, and doing some post-child welfare services for these kids that wouldn't be funded by child welfare dollars. So I'm running the child welfare agency, and I'm like, this is not going to be funded by us. We need, we need TANF dollars, we need, employment services, we need housing dollars. But I was able to make the case that these kids are going to end up homeless and going into other systems, which may be the prison system, which are not going to be productive. Whereas if we invest in them and bring these other resources, then we're creating different pathways and opportunities for them, but we're also reducing the problems for you. And so really helping to provide context to other folks who may not want to be at the table, or may say, well, that's your problem, good for you. Medicaid is another one, huge. And I know a lot of states and, struggle with engaging their Medicaid partners. And in DC, we're like, look, when we were building a lot of evidence-based practices for our kids in foster care, we had a whole strategy to get those services qualified for Medicaid reimbursement, and basically modifying our Medicaid plan to get approval to do that. That was huge, because that meant that those were dollars that didn't have to come out of child welfare or other resources, that we could appropriately bill them, but we could use them for the kids we serve. And again, able to make that case that this is a collective responsibility. So I encourage you all to make sure you get out of your own zones, and that you're engaging other partners and leaders and people you have to report to really make that case for why this is really important to serve families differently, and disrupt the pipeline of the negative pathways pipeline, and instead invest in more upstream collaborative work. So if there are no other questions, are there any? Okay, great.
You have a lot of experience. I think we all struggle with the issue of how to deal with the changes in leadership, changes in administration, and thoughts you have about the best ways to go about trying to prepare for that, buffer that, be in a position to still make progress even as things change and folks show up in leadership roles.
Great question. Really, really important. So I had this kind of aha when I was in Maryland. When you're appointed by a governor, governor has, 1 term, 2 terms, and some places maybe longer, but there's a limited time. And I thought about, I came in saying, succession planning starts the day you come into an agency, which is what we all learn in our MPA and MBA programs and other things. You got to really focus on succession planning. My aha was that I realized, well, I don't control who the governor or the next governor appoints in my position, right? That's going to be a political decision. But back to that B team, who in most places are going to still be there, and they're not political appointees. They're the folks, it may be at the next level down, it may be at the next level down, but really investing in the staff and creating the kind of policies and practices that make sense, that are not kind of gimmicky initiatives, back to having your data to show this is what we've done. I mean, there's, nothing beats continuity, like a successful track record. And so being able to show we're on this pathway, and, you know, there are metrics that make sense to people that they understand in child welfare. Reducing, safely reducing the number of kids in care is always very powerful to be able to demonstrate that. In DC, 20 years ago, we had 3,300 kids in foster care when our population was about 600,000. Today, we have fewer than 500 and our population is 700,000. The strategies, the practice changes, the system changes that we made to reduce the number of kids in care and to demonstrate that we were doing it in a responsible, safe way. They're not bouncing back in. They're not getting, our re-abuse rates didn't spike, were enough that no one wants to change that. So it wasn't that, and we created our model, our child welfare system reform model that had a name and it was all packaged neatly. It's not about that. It's like, what did you do to get these outcomes? What did you do to really start changing the way you were delivering services and creating systems? So I think it's results. I think it's using the data. I think it's really making sure that that there is that buy-in, and and using our partners, using our federal partners with these large initiatives, the Families First, the Stronger Together's initiative, and really saying, wait a second, you've looked all over the country and have used the data and evaluations to lay out a framework that works and that the federal government wants jurisdictions to use. So moving, beyond initiatives and projects to that systems transformation and building the organizational infrastructure that makes sense so that it carries on beyond you. Those shade trees, they have to continue. Thank you guys so much. Good luck.
I really like the way that you carried a lot. I would say it's the. Thank you. I really.
Thank you, Brendan. I really like the way that you characterize the FAST LC as an investment in system change. That is planting the seed for the shade trees, not necessarily the end all be all. And I like that. That is what we're doing. We're making an investment. So thank you again. Can we give her another round of applause? And thank you again for your encouragement of all of us, especially the team members of FAST LC.